Swadikap, good afternoon once again. Today is Monday, the 17th of May, 2021. Today we have some information regarding two issues. First is about the updates on the restaurant measures, as you would have known, because today is the first day that this is in effect, that restaurants in the maximum and highly controlled zones, including Bangkok, are allowed to have dine-in services up to 25% of the capacity. So I'm sure you all know about that. This is effective today on Monday already. The second issue, which I'll go into a bit later, is of course about the prison clusters. Now both of these issues, firstly the restaurant issue, we have some programs after this wherein the Restaurant Association will be coming and to be talking to the public about this. As for the prison cluster issue, this morning the Director-General of the Corrections Department had a press conference explaining, clarifying about the cluster situation in the prisons in Thailand already. And I'll go into a little bit of that later on. But firstly, to recap from the weekend that we just passed on Saturday and Sunday, you can see that we have adjusted the rezoning of the various areas in Thailand. The summary of the latest restrictions to contain the latest wave will also be on screen there. These infographics can be found in the Public Relations Department Facebook page, and I've actually talked about this in the past days already, so you can go and look at that in the social media pages. On the general situation and the statistics that we have for today, I'd just like to start off briefly, just a little bit different from the other days, by saying first that every number, every digit is a life. So as we talk about the numbers each day, we realize that every number that we're talking about is a person's life. For confirmed case today, we have recorded, you see on screen, 9,635 cases. Now, of course, this is a high. It's a new high that we have never seen before in Thailand. However, the majority is detected in prisons. So in detail, 9,635, out of this number, 2,777 are from local transmission. So a little bit higher than the past few days where we had in the 2000s. This is 2,700 plus. Also, of this number, of the 9,635, 6,853 are detected in prisons across the country, and 9 are from overseas. Currently, we have 43,268 active cases still being treated in hospitals, and we have 25 new fatalities to report to you today, unfortunately, making the cumulative fatalities at 614. Most fatalities today are patients with high blood pressure and other underlying diseases, so our condolences go to the families. Just some observations on the new confirmed case of COVID by area and by risk factors. This is the information that CCSA uses to determine the disease control zones and related measures. And as you can see, the majority of cases are still from Bangkok as the hotspot, and from confirmed close contacts as well. This is why physical distancing remains very important at curbing the transmissions. So today we reported 400 patients, or around 33% of all patients, being on ventilators. And more than half of this number are found in Bangkok. On the 25 fatalities today, 18 from Bangkok, 7 provinces reported 1 fatality each. So those are Suphanburi, Sukhothai, Samut Sakhon, Samut Prakan, Nonthaburi, Nakhon Sawan, and Chainat provinces. And the majority of fatalities passed away between 1 and 2 weeks after they were confirmed with the virus. In terms of the area distribution in Bangkok, there are now 28 clusters, active clusters in Bangkok, in a total of 19 districts. Regarding the prison cluster, and I had mentioned that the Director General of the Corrections Department had a briefing earlier this morning already regarding the numbers found yesterday. So on this, during the 1st to the 16th of May, for the first 2 weeks plus of this month, health authorities have actually been conducting active case finding and checked over 24,000 inmates in a total of 8 prison facilities in Bangkok, Nonthaburi, Chachoengsao, and Chiang Mai provinces. And of this number, around the 24,000 inmates tested, around 10,748 inmates were found to be infected, and another 2,200 are waiting for their test results. So this is a span of the past 2 weeks until yesterday, the 19th of May. But of course, today we have recorded 6,800 plus. Authorities give utmost importance to the COVID transmissions in prisons and reassures that all cases will receive proper medical treatment. And of course, active case finding also continues in Bangkok and its periphery. In prisons, just an additional information in prisons is that today we recorded nearly 6,800 plus inmates, mostly from active case finding. And this high number of infection is due to the intentional mass testing on prison officials as well as inmates. So those that inmates are in contact with officials as well to detect and contain COVID. And the Corrections Department had revealed that most of the inmates were being treated at field hospitals set up outside prisons or at the Corrections Department hospital, while those in serious conditions had already been admitted to hospitals. So just to reassure the public once again that the Thai government is providing adequate health protection according to standards and care for all prisoners and detainees, in particular during this particular outbreak in the various prisons across the country. So hoping that will continue to be contained. Dr. Tweesin mentioned just now as well regarding the construction workers camp in Laksi district of Bangkok, wherein the CCSA meeting this morning gave importance to isolating confirmed cases from this district and discussed the possibility of setting up a field hospital inside the worker camp complex, as well as creating a bubble to prevent people from entering and exiting the area except for emergencies. The meeting also discussed about the communications with surrounding communities to raise awareness on precautionary measures and to prevent the further spread of the virus. Of course, communications in different various languages of migrant construction worker community, as well as we talked about last time, that we had a lot of media products and infographics and information sent to construction companies in Burmese and Khmer and other languages. Just an update on vaccination. The rollout continues. So as of yesterday, more than 2.3 million doses of vaccines have been administered. And of this number, more than 1.4 million have received the first dose, while the remaining have been fully vaccinated with the second dose. The Health Ministry strongly recommends that members of the public continue to remain vigilant and observe DMHTT. We have, as always, an infographic from the World Health Organization on how to protect the elderly family members from COVID-19, because, of course, many of you remain concerned about the safety and the vulnerability of family members, especially the elderly and children. And you can see that on screen and look for it in the social media page of the World Health Organization. Also, since today is the first day in terms of the implementation of dine-in in restaurants in the 4 provinces in the dark red zone, including Bangkok. I have for you an infographic regarding the relaxation of restrictions, including dining. When it includes dining out, we have to continue to remain cautious in closed spaces, wearing masks throughout your time in the restaurant, and only to remove your mask when eating or drinking. And you can see the visual presentation there on screen. And of course, wash and sanitize your hands regularly and maintain social distancing because, of course, as we all know, the pandemic is not over yet. Once again, just to repeat one soundbite that I mentioned just now, we know that all the numbers we mentioned are our lives. One number is one life. And we will continue to give importance in reducing the number of people who are infected as much as possible through all of our integrated efforts. So we thank you, we thank everyone for your continued understanding up until today. As soon as there is any important information that is relevant, particularly for the foreign community, perhaps this week, I'll deliver that to you as soon as possible and through other various channels as well. So thank you very much for your attention. Have a happy rest of the week, and I'll see you tomorrow. สวัสดีครับ
ครับขอบคุณ